This is my audience. Today I'll be giving my hero speech on Florence Nightingale. Imagine a world full of sick and wounded people, a higher percentage than there is today. Waiting rooms are full in need of people in need, filling the room with germs, spreading them back and forth, decreasing every single person's health second by second. Finally, we've been called back to a room to be cared for, yet it's filthy, little ventilation, and the supplies that are used to assess and implement care are unsanitary. Under these environmental conditions, more harm is being done than good. I could never imagine working, let alone being cared for, under these conditions. These are the conditions that Florence Nightingale began her nursing career with in 1853. These conditions were considered normal, but in 1854 she led a group of nurses to care for wounded soldiers in the Crimean War, and she decided changes needed to be made. In the article, The Legacy of Florence Nightingale, the First Professional Nurse, written by the British Red Cross, published May 10, 2023, states, Nightingale and her nurses arrived at the military hospital in Scutari, Turkey. They were shocked at the terrible conditions, with a lack of medicine, low hygiene standards, and mass infections were common. From here on, she went above and beyond to better the conditions of the environment of the ill, impacting the nursing profession. As a healthcare professional myself, I am grateful for the improvements Florence Nightingale has brought to the nursing field. I see firsthand how often the nursing profession is working hard to enhance and implement the sanitation standards to prevent infection and give the ill better chances of recovery with little to no complications. Florence Nightingale is a public figure who has impacted my life, even though she has been deceased for over 116 years. Not only has she impacted my life, but she has impacted every human being's life. Florence Nightingale is the founder of modern nursing. She has impacted the nursing profession by dedicating herself to care for the poor and the sick, establishing proper sanitation and hygiene, and she has formed nursing into a respected profession. Therefore, we will first begin with Florence Nightingale's desire to help the poor and sick and how it has an impact on all of her accomplishments. Next, discuss the environmental theory, and finally, how she has helped improve the nursing profession altogether. To begin, Florence Nightingale's strong desire to care for the poor and sick is what led her to achieve all of her accomplishments. First, we will discuss Florence Nightingale's calling to be a nurse. Florence Nightingale is the daughter of a prominent and wealthy British family. Her family expected her to marry and raise a family, but she refused. Because she believed that nursing was not something she should pursue, because one, it wasn't considered a respected profession, and secondly, her social standing. Although she was wealthy and could have chosen a simple life, she refused. In the article, Florence Nightingale, written by Carrie Lee Alexander, published in 2019, writes, Florence Nightingale was homeschooled by her father and expected to get married at a young age. However, when she was a teenager, Nightingale believed that she received a calling from God to help the poor and the sick. Despite her father's opinions, she knew she was put on this earth to help people in need. Her father eventually allowed her to follow her calling. If Florence Nightingale did not stand up for what she believes in, the nursing profession would have not evolved into what it is today. In the article, Environmental Theory of Florence Nightingale, written by Megan Kilpatrick, published May 23, 2024, explains, as a result of her trailblazing work, International Nurses Day, celebrated on May 12th, her birthday, and the Nightingale Pledge is taken on by many new nurses. Her courage to pursue a nursing career has left a great impact on the nurses to this day. Now that we have discussed how Florence Nightingale's desire to care for others has led to her accomplishments, let's discuss how the environmental theory came about. Florence Nightingale created the environmental theory to improve environments for healing. During the Crimean War in 1854, Florence Nightingale led a group of 38 nurses to care for wounded soldiers. When they arrived, she was stunned by the unsanitary conditions and knew that healing was not going to be accomplished in this type of environment. According to the article, The Legacy of Florence Nightingale, the first profession nurse written by British Red Cross, published May 10, 2023, Nightingale's focus on cleaning and washing hands helped improve conditions. We now know it is one of the best ways to stop the spread of disease. As someone who has been working in the medical field for over 3 years, proper hygiene is the #1 stress requirement. Megan Kilpatrick, the author of Environmental Theory, Florence Nightingale, clarifies that the environmental theory consists of ventilation and warming, light and noise, cleanliness of the area, health of houses, bed and bedding, personal cleanliness, variety of food, offering hope and advice, and observation. During the Crimean War, mortality rates were exceedingly high. Once Florence Nightingale had discovered all the components of the environmental theory, mortality rates began dropping. The development of the environmental theory is the first factor that impacted modern nursing. Now that we have established what the environmental theory is, let's discuss how it led Florence Nightingale to form nursing into a respected profession. When Florence Nightingale began her nursing career in 1853, it was not seen as a respected profession, but thanks to her, it is now one of the most respected professions in today's world. After the Crimean War, she was seen as a heroine, and she wished to continue her work to improve the nursing profession. She did so with the Nightingale Fund. By 1860, she was able to open the world's first professional nursing school, Nightingale School of Nursing. Once the school was open, it encouraged places around the globe to open more schools for nurse training. With more schools opening, the reputation of nursing as a respected profession began to be accepted. The authors of the article, Florence Nightingale, Visionary for the Role of Clinical Nurse Specialist, published May 31st, 2020, explains that Florence Nightingale's tenacity has resulted in outcomes that have transferred medicine to a higher level of diligence, advanced a framework for nursing practice and education, and influenced healthcare around the world in the fundamental areas of public health, sanitation, infection control, nutrition, and health promotion. Accomplishing this was not an easy thing to do. Females during this time were not seen professional, especially not above men. She had encounters with many men who were jealous and refused to take orders from females, according to Matthew. She swayed their opinions through expert care, outcomes, and professional demeanor, eventually overcoming their skepticism. Instead of dwelling on the opinions of men, she chose to continue with her work for the well-being of all human beings and to ensure appropriate care for their overall health. Florence Nightingale overall has positively impacted the nursing profession. I have stated 3 main reasons on how Florence Nightingale has impacted the nursing profession. These 3 reasons include her calling to be a nurse, the development of the environmental theory, and she has formed nursing into a respected profession. Everything that she has done for the nursing profession has impacted me personally because I decided to go into the nursing profession myself. She has given nurses in today's society a better working environment by creating proper sanitization standards and has given nurses the respect they deserve for caring for the sick and the wounded. Florence Nightingale is my hero because she was a selfless woman who dedicated her life to care for those in need, and that is who I aspire to be. One famous quote from Florence Nightingale is the very first requirement in a hospital is that it should do the sick no harm.